Hi, my name is Melissa, and I am here from the state of Hawaii. I work as a medical professional. I am an anesthesiologist, and my entire life I've been a big girl. And a couple of years ago, I had the weight loss surgery, I had a gastric sleeve, and managed to lose the amount of weight that I wanted to lose, and decided to go ahead and take the plunge and have my skin removed, and also take care of another problem that I've had since about my mid-20s, and that's my upper eyelid. My upper eyelid's taken care of. I had 3 procedures done. Of course, as I just mentioned, I had removal of the skin of my upper eyelids, and I had a circular tummy tuck as well, and the removal of the skin from underneath my arms to kind of get rid of the bat wing effect. But anyway, I first heard about Dr. Suarez and his team here at CER Hospital, CER Hospital, and I heard only very good things about it. I've never really wanted to have an elective surgery, but at this point in time in my life, I thought it was the proper thing for me to do, and I became very excited about removing that extra skin that from my weight loss. So I came here and met MJ. MJ is our patient coordinator, the patient coordinator extraordinaire, I will tell you. We had been planning this trip for over a year to Tijuana. Of course, she kept in contact with us the entire time. She answered every single question, no matter how big or how small. She kept up with our health history, encouraged us and told us how to prepare for surgery at the time. And being in the medical field myself, I kind of knew how to prepare, but even if you didn't have a medical background, you feel extremely comfortable in the preparation for your surgery. But we arrived in Tijuana mercy about 4 days ago, and I had surgery the following day. We were picked up by a gentleman, very kind, took us across the border. No problems at the border crossing, and I want to reiterate, it's very safe here, it's very nice. This is a beautiful hospital. Dr. Suarez was my surgeon, and he is also the owner of the hospital, so I've come to understand. But from the moment I arrived, I have been treated with utmost respect. Everybody here seems to understand English if you don't know any Spanish. My Spanish is very broken, however, they seem to understand. But the language barrier is no problem here. The people are very professional. I felt actually at home here and very safe. I felt understood. My fears were understood. My concerns were understood. And then, the day of surgery, I got to meet Dr. Suarez, and he went through and told me about my procedure. And also, I have to tell you, MJ, again, the patient coordinator, sent us pictures, and so we knew what to expect from this process. But when I met Dr. Suarez, a very gentle man, very knowledgeable, you can tell when you meet him that he is supposed to be a plastic surgeon. You can just tell. He is very precise in how he approaches the markings, and he can tell your body habitus and how to mark that so that both sides are even. As most of us already know, we don't have even sides. But I felt very comfortable with him, very comfortable with the staff. People smile here, they're genuine, and they know what they're doing. As a physician, and probably knowing too much as an anesthesiologist, I know what goes on in surgery, and from top to bottom, I feel great. The anesthesia went well, and the procedure seemed like only 5 minutes, as everything does when you have surgery. But when I woke up, I was not in pain. I immediately came back to my room from my post-operative recovery, which I really remember none of. But an important thing for me over these last 2 days, I am 2.5 days out post-op, as you can tell by my eyes. But I'm comfortable. I actually have never been in much pain, if any pain at all. What they use is a lot of anti-inflammatories here and medications that help with the pain, but they are not narcotics. And that's really important for me as a physician, because I didn't want to take a lot of narcotics, knowing the side effects of nausea and vomiting and dizziness and being really overly sleepy. But these non-narcotics actually help you with the pain, and they help you with the inflammation so that you don't really actually feel the pain. And I really respect the fact that they have approached this from this aspect. Again, I feel it's the very, very, very best way to treat pain. But I've never had any since I woke up. I feel like just seeing what they've done for me, I am really looking forward to the end results, which will come in a number of months. I feel comfortable. I am very mobile. As I said, we're about 60 hours out of surgery, and I do have my drains. They're hidden underneath my clothes, and they're very explicit on their discharge summary about what medications to take, how to take them, and the need for antibiotics, continued antibiotics, so you don't get an infection. Again, I wanted to reiterate about the building. Everything is very, very clean, and the food is very healthy for you. But anyway, the instructions, the discharge instructions were precise. I'm very thankful to have come here. I feel like this was the place that I was supposed to be, and I will encourage anybody to come here. In all honesty, I've already encouraged another person to come here, and she did come here and have a very great experience. And so I hear by word of mouth. I think you will not be disappointed. I think you'll actually be very happy. The savings that you have versus the money that you would pay in the States is very nice. It's just actually been very helpful for us. And so I think that you should consider this place, and I know you won't be disappointed. So thank you, and we hope you come here. Thanks very much.